Okay, good evening, everyone. I'm Dr. Cheryl Holder. I'm Executive Director of the Florida Clinicians for Climate Action. Welcome to our first in a series of 6 webinars on climate change and health, and we're starting with Climate and Health 101. We have a great speaker, and I'll get to her bio, but before we get started, remember in 24 hours, we want you to evaluate the program and to give us some feedback. The session will be first a presentation by Dr. Joseph, by our nurse practitioner Joseph, followed by a Q&A. So get your questions ready. You can put them in the chat, but you can also ask them with our facilitator who's in the back, Patrice Tyson. So we will get started, and our speaker today is Elizabeth Joseph. Now, Elizabeth is a board-certified nurse practitioner educator who's been in the Jackson Health System 30 years already. She's currently the coordinator for the Advanced Burn Life Support at Jackson. Long history in sustainability and global health. She has a certificate in environmental policy, international sustainable development from Harvard, and she's co-chair of the Jackson Health System's Climate Committee. She's always worked with the Alliance for Nurses for a Healthy Environment, which ANI is the only national nursing organization focused solely on the intersection of health and the environment. She brings a tremendous amount of experience over the years in these areas, and she's done lots of success with the organization and with the committee at Jackson in decreasing anesthetic gases in the OR, styrofoam use, electric vehicle charging station, and received awards from Jackson for her excellence in environmental work. Also, I got to throw out, she is a yoga instructor. So she's able to combine this work with her work-life balance. So I know it's possible. But with that, we thank you, I keep saying doctor, but Ms. Joseph, nurse practitioner Joseph, and we're you can share your slides.
Sure. Thank you, Dr. Holder, for that introduction. Welcome, everybody, and I hope you guys had a great day at work, or if you went to the beach, or even shopping. Well, thank you for being here. I just wanted to share my passion. This is near and dear to my heart. These are the learning objectives. The ways of climate change affects public health, identifying 3 actions nurses and healthcare workers can take to advocate for climate solution, and we're talking about populations that are more vulnerable to the impact of climate change. So, some people have put forth the idea that natural phenomenon rather than the burning of fuel is the cause of the increased temperature of the earth. This graph, if you look at it, clearly shows that much of Earth's temperature would have risen based only on natural phenomenon versus the increase in the output of greenhouse gases like carbon dioxide, methane, water, and water vapor. So if you see the difference, the actual rise in temperature track, whereby you can see this in this gray area, is expected because of the greenhouse gases. So, if you, this is another diagram that I wanted to show you that, if we do not do anything, our carbon dioxide levels and our temperature increases as our global human activities, all the energy demanding activities that we do, like, all the burning of the fossil fuel and so forth. So carbon dioxide is a significant heat trapping, and I'm going to talk about it more in this presentation, and it's known as a driver for climate change. Carbon dioxide is released to the human activities like burning of the fossil fuel and deforestation. Certain natural processes releases carbon dioxide, like plants and human respirations and volcanic eruptions. But remember, natural processes are not causing this problem. The rate at which humans are pumping the greenhouse gases in the atmosphere is creating this significant rise in the temperature and carbon dioxide. Yep. You can see how the temperature over the years and the CO2 level have caused increase in there. So, I just wanted to let me explain how this global phenomenon works. this global warming phenomenon works. So global warming refers to the Earth's rising temperature. Climate change includes not only global warming, it refers to both human and natural occurring effects on our planet's climate. On the left side of your screen, you can see that we have solar radiation coming to the Earth's land and oceans. Some of it is absorbed by the land and the oceans, and the rest goes out in the atmosphere, depicted by this arrow. There are also natural occurring greenhouse gases like methane and carbon dioxide and nitrous oxide that uh, normally trap the sun's heat, which is but it's about homeostasis, keeping our planet from freezing. When we have normal levels of greenhouse gases, more heat escapes back into the space. But however, because of all the activities that's causing the problem, if you look on the right side, we see human activities such as the burning of the fossil fuel for a gas for the car and coal for a factory. These are increasing the greenhouse gas levels, leading to an enhanced greenhouse gas effect. Or simply putting it like putting a blanket over. If you see this red area, it's putting a blanket over the Earth's atmosphere. So the thicker the red circle is, the less heat is escaping into the space. So where does the heat go back to? Back into the Earth, resulting in global warming and unprecedented rates of climate change. So what does greenhouse gas comprise of? I already spoke about carbon dioxide, from the burning of fossil fuel, solid waste, trees and other biological materials and certain chemical reactions like manufacturing cement. All this produce carbon dioxide. Then we have methane. That's another part of the greenhouse gases. Can anyone in the audience name one of the largest source of methane? I don't know if they have, are they unable to speak, Patrice? If not, don't worry. So,
No, but they can put it in the Q&A.
okay, yes. So one of the largest source of methane is the flatulence from the cattle industry. You know, a lot of us, probably, think it's funny, but it's a lot of the agriculture industry is the number one cause of the methane gases. But it also, methane is also emitted during the production and transportation of coal, natural gases, and oil. And other agriculture practices, and also by decay of organic waste in municipal solid waste landfill. Nitrous oxide is another type of greenhouse gases. This is emitted during agriculture and industrial activities, combustion of fuel, fossil fuels. Then we have the fluorinated gases as well. So many many journals have stated over and over again that tackling climate change could be the greatest global health opportunity of the 21st century. And many, industries are paying attention to this statement. So impact of climate change is huge. This pictogram speaks volumes of the effect of it. There are four categories. We have the direct impact, such as the extreme heat. We have the air pollution. We see this in our patients. Patients coming with increased rates of asthma, cardiovascular diseases, extreme weather, extreme heat stresses. Another category is the spreading of the diseases, especially from our changing in the vector ecology, contaminated water from runoffs, from the increased sea level rises, contaminated food, disruption of food supply. This is going to be causing a major problem globally because of hunger and malnutrition and forced migration, which then makes more and more people to have more issues with their disruption of their well-being, issues with their mental health and physical health. Unfortunately, it's the vulnerable population that gets the most affected with all these changes in the climate. in our low-income communities, communities of color, uh, the children, in those with limited language proficiencies these are the groups that are most affected by this. So extreme heat is, we have seen this with our patients, the amount of heat strokes and dehydration. I'd like to share a story that actually happened here at one of our hospitals. JT, the gentleman named JT, he was a 27-year-old who migrated from Mexico to South Florida in 2023. He was so excited to start a new job in the sugarcane farm. Unfortunately, 4 days later, he suffered a fatal heat-related injury while working on the farm, in an open farm, and whereby the heat index was 108 degrees. It surpassed that. He passed away at the hospital with no family members at his bedside. Unfortunately, these type of cases are increasing. We see this on a day-to-day basis. So as scientists, all globally, unequivocally have high confidence that global temperature will continue to rise for decades to come, largely due to greenhouse gas productions by human activities. The Intergovernmental Panel on Climate Change, the IPCC, which includes more than 1,300 scientists from the United States and other countries, forecast a temperature rise of 2.5 to 10 degrees Fahrenheit over the next century, which is serious, guys. And I mean, of course, unfortunately, the potential future effects of climate change includes more wildfires, longer periods of droughts in some regions, and increase in the number and duration and the intensity of tropical storms. You and have experienced this in the past, and this is happening more and more on a yearly basis. So, our planet is experiencing more and more extreme hot days than at any other time in human history. Over the years, the world has seen an average of 26 additional days of extreme heat as a result of climate change. We felt that in Florida. Last year, we had 10 extra days of heat here in Florida itself, and we felt these things. We're living these things. How I'm talked about the different types of illnesses, and I'm going to break it down a little bit in the types of medical conditions that may occur from the exposure of heat. The extreme heat can worsen or cause new onset of other illnesses, and can cause severe not only dehydration. It's so dangerous because of the increased pollution, like ground level ozone and particulate matter, which I'm going to expand on, which in a couple of slides, which can worsen cardiovascular diseases and respiratory diseases like asthma and COPD. Extreme heat can cause cardiac stresses, which can aggravate previously diagnosed heart diseases or cause first-time chest pains or shortness of breath. The American Heart Association recently published a review of many studies showing that an increase in stroke during hot weather, mental illness, kidney disease, all these an increase. Some researchers are linking climate change to the increase in kidney diseases because the heat stresses and persistent dehydration that causes kidney damage. Approximately 10% of the US population suffer from kidney stones. And did you know that the southeast US is called the Stone Belt because people in the southeast are 50% more likely to develop kidney stones than the rest of the country. You probably know someone at risk for illness due to extreme heat, especially our older populations, because they are less able to thermal regulate adequately. They often have pre-existing conditions which make them more at risk for heat-related illness. People with pre-existing illnesses such as diabetes, high blood pressure, and lung diseases, kidney disease, people who are obese are at high risk for heat-related illness. Some medications can hamper the thermal regulations. People who live alone or have physical disabilities are often unable to leave their home to go to an AC area to get any help. Pregnant women, that's another vulnerable population. They're at risk for preterm birth and delivering low birth babies during extreme heat. These are the two leading causes of infant mortality. So pregnant women should be encouraged to stay hydrated and cool during pregnancy, especially during the third trimester. And infants are more at risk also because they are just not their bodies have not adapted yet, are not developed yet. People with mental illness have a triple the risk of death due to heat related strokes, especially those with dementia and drug abuse. People with limited incomes often have this, they have to decide between food and medicine or electricity. They may underutilize or may not have access to AC. There are homeless people or outdoor athletes. Teen athletes, especially our football players, are at increased risk for heat strokes. I don't know, you might probably remember the news story. There was a story of a Lee County high school football player in 2017 who died in the summer of 2017 after hours of practice, over 90 degrees of heat. Some communities of colors are more at risk. Heat-related deaths are 2.5 times more likely among African Americans than non-Hispanic whites. This is primarily due to higher rates of underlying diseases and lack of access and use of AC. Also, a large percentage of this vulnerable population live in urban areas impacted by the urban heat island effect. So air pollution has been increased because of the wildfire, the smog, the pollen, the mold, and of course, air quality is something that we have to be mindful of because this is an important aspect of the air pollution from different sources, such as burning of the fossil fuel like coal, fuel oil. When these fossil fuels are burned, they release particulate matter into the air, which is a mixture of small particles and liquid matter, like droplets that comes in various particle sizes. Unfortunately, when in a normal sense, if we inhale these particulate matters, our natural defense, thank God, our natural defenses can help us cough it out or sneeze this out of our bodies. But however, it's the smaller ones that can be inhaled into our lungs and get trapped or cause irritation in our lungs, or even pass into our bloodstream, causing heart issues. Some studies have indicated that air pollution may trigger an exacerbation of asthma and other respiratory problems, since respiratory issues can be triggered by airborne substance. So does air pollution increase the risk of getting coronavirus? Well, according to a study done by Dr. Bernstein, who was the director of Harvard Center for Climate Health and Global Environment, and I quote, he said that the air pollution is strongly associated with people's risk of getting pneumonia and other respiratory infections and getting sicker when they do get the pneumonia. And as we know, people who get COVID-19 may all develop serious pneumonia. So we see this type of things happening all over Florida. We are very familiar with this smoke coming out from when we drive through 595 heading west. Unfortunately, this is an yearly event. We see this all throughout, especially from our west coast areas. 400,000 acres within Everglades are burned on a yearly basis. Florida alone emits 17% of all annual carbon dioxide, carbon monoxide, and particulate matter 2.5 emissions. Palm Beach County and Henry County emits more pollution from agriculture fires annually than any other U.S. counties. And this is serious. And 3,000 tons of hazardous air pollution are released. You have the benzenes and the formaldehyde all released, and this is all what we are breathing and it's affecting our health. Sugarcane burning, and many studies over and over has associated that burning of sugarcanes, the outcome of respiratory disease, the poor infant health outcomes, the decrease in number of red blood cells, and the liver and kidney damage, and the list goes on and on and on. And you probably have experienced some of the severe allergies that in your own lives. I certainly have. And this, exposure to unhealthy levels of ozone level can damage the lungs and worsen allergic response to pollen allergies. And there's an NRDC report found that there are 275 counties in the US, home to 109 million people, that experience both ragweed pollen and unhealthy ozone days. The allergenic pollen seasons during the past decade starts 3 days earlier than the previous decades, and the average daily count and peak values have increased considerably over the last few years. Increasing allergens, increasing carbon dioxide concentration equals more pollen. More pollen, more leads to earlier flowering bloom, which affects the timing and disruptions of allergens such as pollen. In Florida alone, pollen from trees is being released more intensely year after year because of climate change. Thus, it's anticipated that respiratory allergies and asthmas will become more common and severe because of increased exposure to the pollen as a result of climate change. So keep this in mind when we have patients come in with allergies or exacerbation of asthma. So another impact is our vector-borne diseases. These are the illnesses, these diseases that are human illnesses caused by parasites, viruses, and bacteria that are transmitted by vectors. Vectors can include, mosquitoes, it can be ticks or fleas. One type of the vector that we have experienced here in Florida is the Aedes mosquito. This mosquito carries the Zika virus, the West Nile virus, and the yellow and dengue fever. I don't know if you probably remember that in 2016, the first recognized outbreak of mosquito-borne transmission of Zika virus happened here in Miami-Dade County. And temperatures play an important role in the vector survival, the viral replication, and infective periods. So higher the temperature from climate change, you could expect that in geographical areas, decrease the incubation period of the pathogen and increase the biting rates of mosquitoes. According to CDC, illnesses from mosquitoes, ticks, and fleas have tripled in the United States. And more, we are seeing that introduction of more mosquitoes and ticks in all parts of the country, not only in warm areas, but also in areas such as up north and so forth. So warmer temperature, these mosquitoes and ticks can able to reach higher altitudes. They're able to expand to regions farther from the equator. And I mentioned earlier, they're, due to increase in our hot and humid weather, the mosquito season has grown over in major cities. And also the eggs can hatch faster in warmer climates. So we can see this little graph. In 2004, we used to have less than 200 cases of mosquito-borne diseases and tick-borne diseases. But look, not in 20 years later, 2016, here we are. Look how considerably the amount of cases of mosquito-borne diseases has surpassed 1,000 cases or more. And same with the tick-borne diseases, surpassed 200. And this is going to continue if we do not do something about this. So not only extreme heat causes the illnesses, but related to our land, but it's also causing problems with the sea level rises. With continued ocean and atmospheric warming, sea levels will likely rise for many centuries at rates higher than that of the current century. In the US, almost 40% of the population lives in relatively high population density coastal areas, where the sea level plays a role in flooding. We have seen shoreline erosions and hazardous from storms. And also, this is a global phenomenon. Also, globally, in the 8 of the world's 10 largest cities are near the coast, according to the UN, and especially our small island states. We see a lot of coastal erosions, a lot of extreme sea level rises. And this is a picture of a king tide that was taken by one of our panel members. Is it's a higher than normal tide that typically lasts about 3 hours. King tides occur naturally and predictably during the months of September to November in Miami. So king tides may cause residents to experience quote sunny day flooding, whereby you see streets or other areas will temporarily become flooded when it's not raining. So this diagram depicts that the 10 cities at risk from sea level rises. If you look in 2070, it's ranked by assessed at risk. So if you look at this, Miami is number one. If you see this from the standpoint of the value of the assets at risk, the number one city is Miami, followed by Shanghai in China, New York, and so forth. With greenhouse gas emission increasing and the planet warming, global mean sea level rise is happening 25% faster than in the late 20th century, which is not only serious consequences for the planet, but this is going to exponentially increase our rise in our it's the amount of money is being spent also. Unfortunately, there's rise in seawater, sea levels, the downpours, all the flooding causes contamination of our drinking water. The heavy downpours and the flooding and can lead to GI illnesses, diseases from toxins in swimming areas and drinking. Across most of the United States, climate change is expected to affect our freshwater and marine water resources in ways that will increase people's exposure to water-related contaminants that causes illness. Some of the water-related illness include waterborne diseases caused by pathogens such as bacteria, viruses, or protozoa. Can also be caused by toxins produced by certain harmful algae and cyanobacteria and by chemicals introduced in the environment by the human activities. Exposures also can occur through ingestion, inhalation, or direct contact with contaminated drinking or recreational water. So you can see that looking at this pictogram, you can see the water running off from residential areas, urban runoff. All this causes problems with our freshwater and causes waterborne diseases and problems for our marine life and for increase in algae blooms. So algae are, with all these runoffs we're seeing an increase in blue-green algae and red tides. Just to give you a little background, algae are plant-like organism that sustains marine life, but they contribute to the food chain, a part of the food chain, and to the oxygen that keeps water bodies healthy. But sometimes when conditions are right, warm water and increased nutrients, certain algae can quickly grow and overpopulate. And we've seen this here in Florida. These form, you've probably seen that scum-like stuff or called blooms like these things can be pushed to the shores by wind, waves, or currents. Some blooms can release toxins that make these ecosystem, animals, and people sick. Scientists call these things the HABs. In Florida, we find these algae along our saltwater and freshwater also. The same with the red tides. You've probably seen these in your beaches and so forth. These are dark red and brown, sometimes with a yellowish tinge. This red tide produces brewer toxins that can kill marine animals and make land animals and people sick. If you've been around red tide, you probably had like a red tide tickle. It's like an itchy throat and cough. It's caused by breathing in, the brewer toxins that have been released into the air. Some of the symptoms that people talk about when they're exposed to this is like nausea, diarrhea, stomach cramps, and so forth. So Extreme weathers, like I mentioned earlier, like the heavy downpours or floods or droughts, can be overwhelming, not only to our sea levels, but also our sewer system, which can lead to sewers leaking raw sewage into our waterways. And unfortunately, it's a vulnerable population that lives in areas where these things, see more and more, when the effect of this is seen more and more. So this picture was taken in 2020. You can see this woman walking through floodwaters in Miami. This happened around May. This during tropical storm Bertha. Brought more than 14 inches of rain to Miami over 72 hours. Extreme floods can, these type of things, can be it used to be a rare event, but they have become more and more frequent, intense, and costly. I remember last year when I had to drive through this, it took me 4 hours to get home through one of these floods. And I saw a lot of cars on the side, stalled, on people, in canoes, trying to go from one end to another end. In the past 2 decades, the world's 10 worst floods have done more than $165 billion in damage, and have driven more than 1 billion people away from their homes. And we all know about Hurricane Maria, that hit Puerto Rico in 2017. Half of the residents live there, below the poverty line, with 3 times the national levels on unemployment rate. It's the worst storm that hit the island in over 80 years. You probably heard that electricity was cut off to 100% of the island, and access to clean water and food became limited to most of the people. And more than 200, there were a lot of people that are left without electricity for a long time. I didn't know this, but about 8% of the medicines consumed by Americans are manufactured in Puerto Rico. And Hurricane Michael was another Category 5 storm, which was Panhandle is the one that got affected the most, making the fifth to make the landfall in the United States. Not only the fifth to make the landfall in the United States, but also very destructive landfall. And rain with storm surge of up to 14 feet, and higher than normal storm surges, and sea level rises in that area as well. So infrastructure is also damaged by these climate-related events. We're not going to go over all of these, but you can see the cost begins to add up, from train tracks, the airport runaways, and the agriculture industry. All of this is affected by this. And, I thought this is a great diagram to depict the types of, extreme weather events happening throughout our nation, and the amount of money that's being spent to mitigate this, or to help the victims of these extreme cases. So how does climate change affect our food supply? This graph shows a web of how, it's incredibly this global food system is incredibly complex and shaped by many interrelated factors that are affected by climate change. The three most prominent challenges for the crops that the crops face are the heat stresses, the pest, and the disease expanding their ranges. And the crops have to respond to these challenges in increasing disastrous way that often diminishes the nutritional value that they carry, and then they also increase the toxins they accumulate. And this in turn results in food becoming less nutritious, and there's a high case of malnutrition because of our problems with the soil now. So increased temperature, humidity, and extreme weathers can, cause a problem with contaminating food, from the illness from bacteria and toxins contained in food. And of course, we have infants and young children and elderly who are affected the most in these areas. The projected yield declines each year, for each 1 degree centigrade of warming. If you look at this, we are seeing the projection of decline significantly in the amounts in the corn, negative 7.4%. In the wheat, the rice, and the soy. These are the four main categories that makes up 2/3 of the calorie intake for all of humanity around the world. So when you see these kinds of drops in yield, that's very serious for those who are already food insecure. So the the higher concentration of carbon dioxide in some plants can reduce their level of micro and macronutrients. This is where the problem begins. The high carbon dioxide concentration cuts the level of key nutrients such as your zinc, your iron, your calcium, and magnesium by 5 to 10% in most plant species. This means that most crops have fewer essential minerals per calories and become less nutritious. So this, along with everything else that people have to face, the heat and the sea level rise, it becomes very, very impactful for us as a society to not pay attention to these things. And don't let me get started on the mental health problems and with the increased frequency. And we saw this in Puerto Rico, where the suicide rates after the Hurricane Maria, it jumped up 20%. And this is something that we need to address. As a global community, we have to also look at how these threats are impacting mental illnesses. So then, and not only are they the climate change is affecting our health, but it's also a threat to the marine life. It's also a global threat to the coral reef ecosystem. As the temperature rises, mass coral bleaching events and infectious disease outbreaks are becoming more frequent. Additionally, the carbon dioxide absorbed into the ocean from the atmosphere has already begun to reduce the calcification rates in reef building and reef-associated organisms by altering the seawater chemistry through decrease in pH. This process is what's called the ocean acidification. It'll affect the coral reef ecosystem through sea level rise, changes the frequency and intensity of tropical storms, and altered ocean circulation patterns as well. The rate of ocean warming has already doubled since 1992, compared with the previous 3 decades. If you notice in this graph, this is in part by the combustion of fossil fuels, leading to other stuff, leads to ocean acidification. And this all began with the beginning of the Industrial Revolution. The ocean had become 30% more acidic, faster than any changes in ocean chemistry in the last 50 million years, 50 million years. Warming oceans and increased acidity threatens not only the coral reefs, but also the marine life, such that we are dependent on. We humans are dependent on the marine life. And this is, causing a total loss in the revenues for the fishermen, the marine industry. This is what they are dependent critically on fishes for their food. This faces reduced access to marine protein. And furthermore, the oceans have provided a major buffer system for a changing climate. So much of the oceans absorb the heat around us. But unfortunately, as the oceans getting warmer, they cannot act as a buffer system. They can, they also, because of the warming climate and the warming of the oceans, they contribute to more intense storm. So what can we as nurses and healthcare workers do? First of all, we can, start with ourselves, learn about, attend seminars such as this, be aware of what is around us, pay attention to our patients, become, learn to engage in, talks, engage in communicating with their stakeholders, educate our families, educate our colleagues, our patients about the climate impacts and the solutions. Be an advocate. Tell our policymakers we want solutions to our climate change. And I had an opportunity to be in the White House with the EPA 2 months ago. We had 25 different nursing organizations show up, and they listen to us. They know that we are, we make a difference, and we as healthcare industry have a voice in bettering our patients' health and our community's health. We people trust nurses and physicians, more than uh, any other jobs. No, not everyone knows a climate scientist, but everyone knows a nurse, a physician, or healthcare workers, right? That's true. And health is the most convincing reason for people to be engaged and be active on the problems of climate change. And we have the most authority on health. And I like this quote by Edward Maybach. It says, simple messages repeated often by a variety of trusted messengers goes through. So we have to be that voice. So we as healthcare industry, we are a big industry. We make up unfortunately, the same industry that takes care of the health of the people, but we are also a major contributor of the greenhouse gases. 8.5% of our global emissions comes from the healthcare industry. If we were a country, we would be the 13th largest emitter of greenhouse gases in the world. And most of it's coming from our supply chain. And when you work in the hospitals or any other healthcare industry, all the waste that goes on. But however, we have an important role to play in reducing our healthcare environmental impact. And like I mentioned earlier, more than thousands and thousands of medical journals, are publishing for a call for urgent action to keep our global temperature below 1.5 degrees, not only to restore biodiversity, but to protect our health, our patients' health, our community's health. So I already spoke a little bit of how we contribute. There are many ways care professionals can reduce the impact on the climate at work, at home. These are just few examples. Ideas for climate actions. Encourage your patients to have a disaster preparedness plan at home. On hot days, encourage patients to check the health alerts, check the air quality, tell them to increase the water intake. Stay inside in the cooler area, get some shade, educate them on signs and symptoms of heat exhaustion and heat stroke, especially here in Florida. So what can we do in the hospital? We have a greening committee at our hospital where I work, and I'll be happy to share some of the things that we have done to reduce our carbon emissions. We can start small. Things such as only bring supplies into patients' rooms that are needed, initiate a recycling program, initiate composting programs, go paperless, choose reusable supplies, purchase food that is grown locally, and most importantly, find others who are doing this work. We can do all this as a collaborative thing, so we can bring down our carbon emissions. So I mentioned some of the green teams. Many hospitals have started this. Find groups of people that are passionate. There are a lot of resources out there. There's something called the Green Guide for Healthcare. It provides some comprehensive guide to assist healthcare institutions in developing and maintaining environmentally sustainable buildings and practices. I put this out there so you guys can get some resources. There are a lot of hospitals have reduced their red bag, regulated medical waste. You can copy down this link to get more information about that. Consider medical supplies in terms of excessive packaging and unnecessary reliance on single-use items. When washing hands, turn off waters while scrubbing them to conserve water. These are just like few of the examples that that I wanted to share with you guys. My Green Doctor is another great website or link that we can use. Do these 15-minute talk. This is intended to show to officers, managers the benefits of environmental sustainability program. It also explains the responsibility to create officers, green teams, and also to use my Green Doctor for successful green team processes. It's a free download, and please, feel free to copy these things down. Adaptation to climate change is one of the ways we teach our patients is to mitigate the effects of climate change, is to educate our patients and educate our community, our healthcare colleagues. One of the things that we, especially in our emergencies rooms, when they come in, we have to tell especially in Florida, stay inside in AC, cool places, increased allergens, or when during the increased allergens or air pollution, stay inside when pollen count is high. And also monitor news for any sewage spills in the areas and take precautions like boiling water. We do get those boiling water alerts from time to time. Encourage not to swim in waters with overgrowth of blue-green algae or red tides as well. Adaptation to climate change, educating our patients about using insect repellent to water mosquitoes and ensure there's no standing water in the yard. Assure that when you have an emergency plans for hurricane, have those emergency plans in place, especially if they cannot move around, if they need help to evacuate. And also talk to our patients about the health consequences of climate change. So, this is one of the organizations that I'm part of. I'm a co-chair for the Practice Forum. This is a great organization. If you want to join, we have great seminars, great networking, a lot of support. Their mission is to promoting healthy people and healthy environment by educating and leading the nursing profession, advancing research, incorporating evidence-based practice, and influencing policies. These are the ways that you can be empowered by joining organizations such as Alliance of Nurses for Healthy Environment or the FCCA. This is a part of organization that I'm proud of to be associated with. This is a coalition of health professionals and healthcare organizations concerned about the impacts of climate change, and they're doing some great work in Florida, especially for our vulnerable population. And most of you probably know that Dr. Holder is the founding co-chair, and she's also the executive director. If you join FCCA, we can help you to learn more about climate and health and point you to advocacy opportunities like speaking out about inequitable pollutions from sugarcane harvesting, or speaking in favor of stronger efficiency standards to help low-income families, to save money on their electric bill or so. And so FCCA is very involved with in engaging in lawmakers, educating, setting up meetings with lawmakers, and help them to understand how climate affects our health. Because most of our lawmakers, they don't understand. They're not healthcare professionals. So we have to be that bridge that connects and put the dots together for them. The Clio Institute is a great organization. I'm a product of the Clio Institute. It's a nonprofit, nonpartisan organization exclusively dedicated to climate change education, engagement, and advocacy in Florida. I believe this is still a free certification program. I took this program about 4 years ago. It really helped me to go out there and to speak to the communities and speak in seminars such as this. Uh, you know, Please look them up. They're great organizations to be associated with. The Climate Reality Project, this is a nonprofit organization founded by former VP Al Gore, which is involved in education and advocacy related to climate change. And we have members from all over the world. So I'm just giving you some of the things to empower you to be a part of the different organizations so you can be an advocate for yourself, for your family, for your patients, for your communities. So the more advocacy and resources that I wanted to share with you, we have the Alliance of Nurses. I already mentioned Annie. The Medical Society Consortium on Climate and Health has posters and patient handouts you can download. This is a great. I've used this downloads to patient handouts, especially for our heat stressors. Even the FCCA has some great handouts to give out for our patients, how to take care of themselves, if and to know the symptoms of a heat stroke, um, uh, versus when they really get sick, and what to do in case when they don't have anybody around. The Florida Climate Institute at University of Florida also has some great resources. So I want to thank you for your participation in this seminar. I like to end this with this great quote because, as healthcare professionals, uh, we are the voices, we are the advocates for our patients. And I like this quote from the Native American. It's a Native American proverb. We do not inherit the earth from our ancestors. We borrow it from our children. It is so true. We cannot, if we cannot take care of this earth in this time, in this time given to us, what are we passing on to our children and to our grandchildren and so forth? Thank you very much.
Thank you very much, Elizabeth. It was a wonderful presentation. You covered everything. So we want our viewers who are on, give us questions in the chat, and also review this videotape because it's going to be up on the website for Black nurses, and we'll also have access to it eventually on the Florida Clinicians of Climate Action. But in our time remaining, so many opportunities, so many ways to act. But how do you, as a nurse, how do you get started? How did you get to that committee? Because we all want to do something, but how do we get started? What do you recommend?
That's Thank you, Dr. Hull. That's a great question because we get so uh, involved with whatever we are doing, be that maybe, working in the unit or as a nurse practitioner, whatever, emergency room, we're always busy, But, when in that busyness, I saw opportunities. My God, the amount of waste that we produce at the hospital, and we all know it. We time to time, I hear nurses saying, my God, why are we opening up the surgical pack just for one small scissors? What can we do with all these plastic bottles or water bottles? Why are we throwing this in the garbage? People are aware, but we don't know where to start. But this I you know when we started this green committee, we started with low hanging fruits. Started very small. you know it's a good and we gathered some few passionate people and say, what, we let's do something about this. Fortunately, we had the union to back us up, but if you do not have a union, that's okay, that's fine. Go to your administrator and say, let's look into that. But the nice thing about it is that when you associate dollar amount to these savings, hey, why are we opening up the surgical pack? Look, we can save so much money if we can repack these things, or if we can just use, instead of using single use, can we look at reprocessing?
Well, it sounds, what you just explained makes perfect sense. Start small. You can go with
Yeah.
your administrator, go with other people you work with, and reach out at the little areas, some small successes. Styrofoam, repackaging, questioning how even you use red bags, because sometimes I see junk in red bags. And
Yes.
that could be a simple step. as you get your committees together, because that 8.5% greenhouse gases that the healthcare system is responsible for is huge. So there are
Yes,
things
yes.
that we definitely can do for the for our health systems.
Yeah.
And
I'm glad you
you
brought up
know,
the red bag issue because red bag was something that administrators paid attention to because, red bags are autoclaved and it was costing the money a lot of hospital. But if you go around in your patient room, you'll see what goes in the red bag. You'll say, oh my God, you know, I've seen pizza boxes and
yeah, I
paper
know,
towels.
I've
It was,
seen that
yeah,
too.
yeah.
So
So,
all these actions save money. And that's the one thing we find in climate change work. It
mhm,
saves money and it improves your health because we decrease the plastic pollution, we decrease air pollution, we decrease all these factors, environmental factors that's affecting our health. But we have 2 minutes. Where do you see hope? How do you keep this going? Because you've done it for so many years. What's your magic? Tell us.
wow, that's a loaded question. You know, with everything that's going on with the new administration on board, and sometimes I come home crying, why am I doing this? But you know what? I s- that hope. That one thing that well, there's several things that gives me hope. One is the young folks, their
Yeah.
passion and their commitment, and they are much more aware of these issues than we are, and I see little kids, 5-year-olds, 10-year-olds doing something in their schools, and that keeps me going. So you know what, that's why I put that slide in the end, because I have to do it for our kids, our
Yeah.
grandkids, and
The
so
next
forth. If we cannot
generations.
do
You're
it, if
right.
I cannot start, I don't want our kids to look back and say, why didn't you do this? Why didn't you take responsibility and save our earth? You know?
And
So
we can do this together. We really must take action. And we have our committees, we have our individual actions, we have our society actions, community actions, our policymakers, but we'll do it together. And I
that's right.
agree, the young people and working for our next generation gives me hope. Please, thank you, Elizabeth. Thank you, everyone, for viewing. Please complete the evaluations that you will receive in your email by tomorrow, by 24 hours, and you will get your credit. And also let us know what you think and what else you want to learn. Please follow us on FL Clinicians to keep your education going. On Instagram, Facebook is Florida Clinicians of Climate Action. We're on LinkedIn. Lots of information's there. We look forward to every health professional joining us. Joining FCCA doesn't mean you have to come to meetings and do it. It just means taking action daily. Thank you. See you
Thank
on
you,
our next
Dr.
one.
Holder. Have a good evening, everyone.
Bye.
Bye
Okay.
bye.